6:40 is the time. Last Friday, the FDA announced that they were lifting nearly a 20-year ban on silicone breast implants. Joining us this morning to talk a little bit more about it and what that means for patients out there who want to get the silicone implants now is Dr. Renato Calabria. Good morning, doctor.
Good morning. How are you?
Good. You have an office here in the Desert Rancho Mirage, also in Beverly Hills and over in Rome. And you've been doing plastic surgery and reconstructive surgery for about 30 years now, so we can call you an expert in this field, right?
Thank you.
Thank you. You're welcome.
Now, why don't you tell us quickly, why was there an FDA ban on silicone breast implants?
Well, since 1992, when Connie John did that famous expose on national TV, there's been focus on safety of breast implants. Breast implants were introduced actually in 1962, about 40 years ago, and obviously at that time the FDA was not around, so they were kind of further in. Now, after that expose, they were concerned about safety issues and concerns about health issues with breast implants. But now we can safely say that considering breast implants are probably the most expensive device, the most extensive device ever studied in medicine, we can safely say that conclusive studies show that are pretty safe.
And you say that the link to cancer hasn't been proven.
The link on cancer hasn't been proved, no links with autoimmune disease, no links even is safer for mother that breastfeeding. So it's been really showed very conclusively that this device is safe.
So, Dr. Calabria, now that the FDA has lifted the ban, what are going to be the benefits of patients who want to get these versus the saline ones?
Well, as you can see, I brought one here. There is a much improved implant. It's a much improved implant. The gel is more cohesive. The shelf is thicker, so can withstand about 25 times the force of a mammogram. So I think there is much improved. They feel more natural. And I think
they look more natural too.
They look
more
natural, and it's obviously another alternative for women that are considering breast augmentations.
Now let's talk a little bit about the price. Now I know you said that you prefer to use these silicone implants over saline. Are they more expensive?
They are more expensive, but I prefer them because, as we say, they feel more natural, they look more natural. Obviously, we have to emphasize the implants. Any kind of implants are not forever. You need to keep in mind that you may need in 10 years or so to have a revision, or they can form scar tissue around, and so women need to be well informed about breast augmentation. But I think it's very safe.
You were also telling us before we went on that women who want to breastfeed, the saline ones actually cause more pain than getting the new ones? Is that right?
No, the pain is about similar in both. I think either saline and silicone implants are safe in women that breastfeed. So we can say.
So a bit safer.
Right.
Yes.
Now, I know that they have been banned, silicone implants have been banned. They just lifted the ban, but they've been used anyway. What was it? You were getting your second set of implants?
Yes, correct.
What else was it?
They have been available actually around the world in 60 countries, but in U.S. for secondary breast augmentation in patients that had implants before, or in patients for reconstructive surgery, obviously.
So, doctor, tell us, what does this mean to the future of plastic surgery now that these are widely available and a lot of women are going to feel safer to get them?
It means obviously it's a great alternative in breast augmentation. I think this moratorium has been useful to develop a better implants. So for women, actually, it's good news.
Doc, now you've been doing this over 30 years. How many breast augmentations do you think you've done? And have you used more silicone than saline over those 30 years?
We have used in the past more silicone than saline. We have been back to saline for the last 16 years. Is great, and now we have the alternative of using the silicone. So I think it's great for consumers in general, and for doctors, they feel safer.
All right, Doc, there's your number, 836-0077 or drcalabria.com. And one plug for him, tonight on CBS on Access Hollywood, you're going to be featured on there. A little segment, right?
Access Hollywood is on our channel tonight at 7:30. So more with you tonight. Thanks so much for coming in this morning.
You're welcome.
Yeah, thanks for making the drive from Beverly Hills. Appreciate it, Doc.
Time is now 6:45. Coming up, Thanksgiving is just hours away, isn't it?
That's true.
We've got some ideas on what to do with a leftover turkey, and meteorologist Jennifer Daniels is going to let us know how fabulous it's going to be on Thursday. Jen?
Oh, you know it. It will be a wonderful day. Temperatures about where they ought to be for this time of year, but man, will it feel good.